This is Paul Young from the University of Queensland, coming to you from the very labs in which the vaccine is being developed, the vaccine against COVID. To be a mentor and transition from that mentor to colleague status has been an exciting journey for me, I hope for Keith as well. You know, we are true partners in going forward with this project now.
There's no better job than being a scientist. I knew this job was for me from a very young age. You know, I always wanted to make a difference in the world, and it seems like now, hopefully, I've got a chance to follow through with that. So I did my undergraduate degree, my PhD with Paul. I then spent 3 years in a postdoctoral position in Madrid, and then came back into Paul's lab in 2010, and have been there since. I think it's a high pressure situation, but it's really helped us come together, and you know we're all working for the same team and working for the common good. So I think it's a really special and great relationship for Paul and I, and for the whole team. You know, we're all in this fight together. With this outbreak, it's important that we try as many different types of vaccines as possible. We don't know whether all of them will work or one will work. With regard to our technology, it's more of a traditional type of vaccine. It's a protein-only subunit vaccine. So similar in a lot of regard to the traditional flu vaccine. The other approaches that are being trialled are mainly RNA and DNA vaccines. These are great to move really quickly and get the first doses of vaccine immediately, but the manufacture and scale up is a lot further behind. So to produce vaccine for the entire world, it's hard to move those new technologies forward quickly. As our technology is more in line with the traditional sorts of approaches, our vaccine can go into manufacturing plants that are already in existence in many countries and on all continents.
I'm extremely confident with this. I think it's because we've been at this game now for quite a number of years, looking at this particular approach to vaccine generation and looking at how it's able to be put together for other viruses, and the responses we've seen in those other systems gives us a great deal of confidence that we've got the right path forward to achieving a vaccine that's going to have an impact.
It's great to have the support of UQ behind us and the alumni. That is absolutely greatly appreciated. I guess just to know that we're working as hard as we can and that we've got that support is fantastic.
I think we've already started to receive some support in the context of just community support for the work we're doing, just encouragement for the work we're doing. It is very much appreciated, certainly by everyone in the lab who are spending all those hours getting us to where we are. We've recently, for example, had some support through a small donation from St Margaret's Anglican Girls' School, and it just it lifted us all in terms of knowing that there are folks out there who really appreciate the work we're doing and supporting us, and certainly that would be true of all our UQ alumni.